right. Good afternoon, guys. This is Summer from Pacific Cross. So right now we are 8 in the room. So including ako and Aiko and si Joyce, yung ating sales officer. So for today, what we're going to discuss is yung mga concerns natin. Of course, first and foremost dyan, yung paano natin gagamitin yung ating policy kapag effective na siya, di ba? Or sabihin natin, paid na tayo, nasa atin yung card, and then paano gagawin natin kung sakaling meron tayong availment. Kailangan natin ma-confine or magpa-check up. So, yan yung mga i-discuss natin. And of course, I would like to teach you guys on how to use our website. So, we have a website. Ito po yung ginagamit natin for self-help options. Ibig sabihin, by using the website, you may now download the forms, di ba? For example, kailangan yung mag-claim. So, there are applicable forms to use. Depende sa plan ni client, di ba? O kaya naman, if you're planning to visit a hospital for confinement or for sabihin natin outpatient consultation, we also have the form, updated form as well. Yan po yung mga list of accredited providers. So I'm going to share with you guys my screen. Yeah, okay. Oops. Okay, Aiko, can you please help me to yan, to use the share screen function? Oh, sure, sige. Okay. All right. So let me just acknowledge the presence of everyone here. We have here Miss Bless Hernandez. Good afternoon. Miss,
Hello, good
is it
afternoon.
Miss or Miss? Oh, this is Mr. Mr. Giancarlo Mascardo. Good afternoon.
Good afternoon.
Okay. Yes. And we also have here Mr. Mark Morales. Good afternoon po.
Good afternoon.
Yeah. And we have here, what's his name? Murali.
Yeah,
Yes,
hi.
good afternoon, sir. Yes. And of course, last but not the least, Ms. Zenda Revale. Good afternoon, ma'am. Okay,
Yes, good afternoon,
so
everyone.
yes, I wish I can meet you personally, guys, but right now, because we're here in pandemic season, so it's better to be safe than sorry. We're going to discuss it via Zoom, right? So right now I'm going to share my screen. Okay, just a second. So what I'm going to teach you first is how to use our website or how to explore our website. Okay, hold on, let me just access it here. There, and if you have a pen and paper handy with you, you may take down some notes, okay? Yan. So we're able to see this Pacific Cross website. This is the one that I'm flashing right now.
Yes, thank you.
Okay. So once you access our website, it's www.pacificcross.com.ph. Okay. So once you're on the page, you will see this prompt message. So you just have to click continue. Okay. Once you click the continue, it will give you the full access to the page, right? And then under the resources tab, this is the resources tab. Okay. There. Once you click it, you will see the options like brochures and forms, personal health record, client testimonial. So just in case that you want to check the real life stories of our trusted clients, or sometimes they do have testimonials posted on their Facebook pages, you will be able to see it here as well. Okay. And then we have here the SASI. This is it's like an app that we use if you want to do if you want to file your claims for reimbursement. Okay, but first let us check this one, the brochures and form. Okay, so again, the reason why I'm going to teach you this, guys, because I want you to do a self-help options, especially right now that our client services hotline is, I want to say it honestly, that our client services hotline is always busy. Why? Because right now we have a lot of concerns with regards to inpatient, outpatient, mga hospitalization concerns. So, yeah. So whenever you try to call our client services, you might as well be put in a queue. So I suggest, instead of calling that, you would like to reach out to your agents or send us an email instead. Okay, but if you have an access to our website, just like what I'm doing right now, you may explore it like that. We're able to see it, Aiko.
Yes,
There.
we can see it. Thank you.
Yeah. So there are drop down menus here, there. So if you want to apply for example, the Blue Royale, there's the brochure. Okay, the Select Plus, there's the brochure, and then for the application forms, okay, here, there's the application forms. Yeah. Okay. So let's say, hold a second. Let me check there. So that's the website. Let's say you want to use the website to pay your policy. Okay, so you have to click this one, and then we have an easy payment options. These are the guides that you can browse. Okay, it will teach you step by step on how to do the self-help options for payment. Okay, but just in case that you want us to guide you, you can call us, ICO, or you can send a message to me via email so I can assist. Okay, and then for this
There,
one,
I think this summer the
mm,
company will be paying for their policy, so
mm,
I'm in communication with their general manager na lang for payment concerns.
okay. All right. Okay, that's good. That's good. Okay. So for this one, just in case you need to file a claim. So for example, since you are a medical insurance user, like your plan is considered a medical insurance, this is not an HMO. So with medical insurance, you have the freedom to choose your own provider. Like you can go to a non-accredited facility. So all of your claims using or via the non-accredited facility will be under a reimbursement type. So meaning you're going to pay first and then you keep the receipt, okay? And then you have to download this form. So if it's the notification of claim for healthcare or for medical insurance, so of course you're going to use the medical insurance. So you have to download that form and then give it to your doctor. The doctor will sign it and then you're going to send it to us via email together with the receipt. Okay, so that's how you file a claim. So if you're going to ask me, how long do we process reimbursement? Okay, so for claims that are amounting to 10,000 pesos or not higher than 10,000 pesos, the processing will be 14 to 22 working days, provided that all requirements are complete and in order. Okay, so don't you worry, guys, because Aiko is here with us and she's very helpful. She will guide us to check the completeness of those requirements. Okay, all right. So this is the form that you need to download if in case you're going to file a claim. All right. So would you like me to check it here? Yeah. So you will see the, yeah, okay, the details. Okay. So you will just check the box applicable for your selected plan. So I believe your plan is Select Plus, right? So you just have to click that and then fill out the details required. Okay, so that's the page one. For page two, yan. So you will have to nominate your bank account. So reimbursements will be, or the payment for reimbursements will be issued to your bank account, to your nominated bank account. Okay, there. And then there's a portion that has to be signed by your doctor. So if it's inpatient claim, when we say inpatient, you are hospitalized, you were confined. Okay. But if not, let's say, for example, you just visited the doctor's office and then some checkups or laboratory works, this is for outpatient claim. So the doctor will be the one to answer that, and of course, they will sign on that space provided. Okay. So if you want to check the requirements for a certain claim, let's say this is for inpatient, so this is, or these are the requirements. Okay. And for outpatient, these are the requirements. Okay. So the first step is, of course, you need to submit us the completely filled out notification of claim. This one, the one that I'm showing you now. Okay. And then the receipt, of course. The receipt should be named to the client. Okay. Should be named to the client. So you have to send it to us via email. So ICO or one of us will check it for the completeness of the details. And then once done, or once everything is complete, we're going to endorse it to our client services team. Okay. Then after that, we will receive an acknowledgement or an email acknowledgement from the client services team, and then they will give us the turnaround time for the reimbursement. Okay, so always copy your agent for all email transactions with us. Okay, right.
And I
So
just
let's
wanna add lang din,
mhm,
sorry, I'm speaking mix of English and Tagalog, no? So,
okay.
just to add to what Miss Summer said, when she said name of the client, you should actually write your name, not the name of your company. Just to
Correct. Correct. Because guys, all of these policies will be put on the name of the client itself, of the principal insured. Okay, so I understand that we requested that the official receipt should be named to these two company names, and we will do that. However, for each policy that is assigned to each individual, we're going to name it under the principal insured. So whether it's an employee or the dependent of that specific employee. Okay. All right. And by the way, all of you guys, all of the principal insured and even the dependents will be given a separate policy. Okay, so with your policy, it's I believe it's gonna be a soft copy for the schedule of benefits. It's gonna be sent to you via email in a soft copy, but you will be receiving your physical cards. So there will be a physical cards that will be sent to your home address or office address. So I'm going to check the address that you selected for that mailing address in your application form. Okay, there. So please remember, this is the form to download if in case you're going to file for a claim. This is the notification of claim, medical insurance. Okay, so now if you want to check the accredited hospital near your area, or sometimes if you have a dental coverage, you want to check the accredited doctors or dentists within the area, you may download this form. Okay, so for this one, I'm going to start with the hospital. Okay, so accredited providers list hospital, you have to click that. Okay, you may download it if you want, but I highly suggest that do not keep it on your file because from time to time we're going to update it, especially um if we have a new hospital that is accredited with us. Okay, so using that, you may hit Control F. Okay, once you press Control F using your laptop or your desktop, there's a search function. So let's say you're going to search a hospital near your area and you are from Caloocan. Okay, so you have to enter Caloocan and then press that one. So you will see a word that is highlighted. You have to keep on pressing the enter. So you will be prompted to selected hospital, just like this one. It's Manila Central University, so that's in Caloocan City. Okay, and then click for more, so you will be given other options like that. Okay, so let's say you want to check a specific hospital. Give me an example. So, for example, I'm going to search for Capital Medical Center. Okay, that's in Quezon City. So once you hit the enter, it will go to Capital Medical Center. Okay, so there's a contact number if you want to contact the client or the hospital. So there are details of our plan coordinator. So what's the purpose of plan coordinator? Okay, if you're going to visit that hospital for confinement, you have to go to this plan coordinator. Okay, so you will give them your card. They will swipe it. Okay, once they have the approval, there's a paper. It's like a charge slip that will come out of the terminal, and then you have to sign it. Okay, once you sign it, that means that you are now going to be confined. Okay, or if you're going to do an outpatient consultation. See, so we also have here the schedule, just in case you want to check if they are available on that day. Okay, so do you have questions with regards to this accredited hospitals? So it says here as of February 18, 2021. So from time to time that we have an update, we're going to update this form as well. So that's why I'm suggesting that if you want to check if a certain hospital is accredited with us or not, you have to access the website. So you will have the updated one. Okay. Do we have questions, Aiko, regarding this?
Miss Summer, can you share with us the difference of medical insurance with HMO and a pure HMO?
Okay, sure. So the plan that we are getting for you guys, I believe it's the Select Plus. Okay, so let me show you the brochure. Hold a second. Okay, I'm going to close this one and then let's go to brochures. So it's Select Plus, right? There. Okay. So this is the main difference between a medical insurance and an HMO account. When we say HMO, HMO stands for Health Maintenance Organization. Okay, so there's a specific network of accredited providers that are listed within that HMO network. Okay, so if in case you go to a hospital that is not inside that network or not an accredited hospital inside that network, they will not they will not recognize your plan. It's like that they don't care at all. So you will be asked to pay for cash or in cash, and then that's going to be an out of pocket expense. They will not reimburse it, or the company will not reimburse it. Okay, so it means that if you chose if you chose an HMO plan, you have to search for that accredited provider, right? So nowadays, the usual scenario that we have here in the Philippines is that almost all of our accredited providers are full because of COVID-19 cases, right? So the remaining option for us is the unaccredited ones or those hospitals that are not accredited. So meaning the client will pay in cash and then reimbursement should be an option, right? So if you have a medical insurance, you can do that. You can do that. You can go to that hospital. If needed, you can pay. And then once you're paid, you just give us the receipts and then the notification of claim, and then we will pay you back, right? So aside from that, okay, if you're going to check the contents of this brochure, okay, this is the select plan. This is the plan that is offered to you, okay? So if you're going to check that, by the way, do you see the screen that I'm sharing right now, Aiko?
Yes, we can. Thank
Okay,
you.
good. Yep. All right. So if we're going to check that, we have here the three categories. We have the ward, which is the lowest coverage that we can give. Next to that is we have the semi-private, which is the 750,000 pesos. And then the highest coverage for select is the 1.5 million pesos. Yeah? So the reason why we are pushing you guys to get this one is because of the threat of COVID-19. Because if you're going to check the expenses of those COVID-19 related hospitalizations, the minimum that I have here for on my record was 700,000 pesos. Imagine. So if you have an HMO plan, okay, so usually or the typical coverage that is being given to HMO plans would be around 200, 300, 350,000 pesos only. So if in case that you need to be confined and the diagnosis is COVID-19, so you have to, or the client has to pay for that extra charges out of the MBL or out of the maximum benefit limit. Unlike if you have a medical insurance, you can give or we can give you as much as 1.5 million pesos. So we can give you a higher coverage, of course, right? And if you're going to check the contents, there are features here that you will not be able to see if you're going to select or if you're going to choose an HMO plan. So one thing that I can give you is this private duty nurse. Excuse me. Okay. So private duty nurse is only being covered if you have a medical insurance policy. Under HMO, they will not give it to you. Okay. And look at this, the critical care benefits. Excuse me. So under critical care benefits, this is the use of ICU. So COVID clients who are on critical stage will immediately be put in ICU or intensive care unit. Okay. So we cover that as charge. Okay. Aside from that, there. So we can give you surgical benefits. Okay. And medical implants due to accidents. So this should be covered accidents. When I say cover accidents, these are the accidents that doesn't have a violation with our Philippine law. Like for example, if it is a car accident, so the driver should not be drunk. Okay, the driver should have a valid license, not an expired license for it to be covered. Okay, there you go. What else? So we also cover emergency benefits. So we have emergency outpatient, emergency local ambulance services, dental services, and even this one, emergency overseas confinement. Okay, so it's emergency overseas coverage. So just in case that you travel abroad after this COVID season for whatever purpose, like for leisure or for business, okay, and then something happened to you outside of the Philippines, you can use this coverage. Okay, what else? There. So this plan is specifically designed to cover worldwide emergency assistance. So if you're going to check the contents, there are features here that you will not be able to see using an HMO plan. What are they? So we have the emergency medical evacuation. Okay, so usually if you're going to apply for a visa, they will require you to present a medical insurance that gives coverage for this. Okay, there you go. Okay, there. You can browse the brochure when you have time. So if you are checking it now, you may ask me questions so we can discuss it here. Okay, and of course, part of our enhancements recently, it just started November 1, 2020. So we give coverage to autoimmune conditions. So autoimmune conditions will be given coverage after 5 continuous years. So if you're going to ask me what are the examples of autoimmune conditions, we have here the most famous one. We call it the lupus condition. So it's a disease that attacks your kidney, and it is considered an autoimmune condition. So your immune system will be like a candle that is deteriorating as long as you have that kind of illness. Okay, so with autoimmune conditions under medical insurance plans, this is now being covered after 5 continuous years. Okay, and what else? It has an annual physical examination. That's very good. So let's say you pay for your policy today. After 30 days, you may schedule your annual physical examination. Okay, so you just have to send us an email with the details of your preferred date. Okay, with the details of your preferred clinic, or if you want, you can browse our website to check the accredited APE clinics near your area or near your location. Okay, and then we're going to confirm the availability of that schedule. Okay, so it includes not just the basic five, because usually they will only give you the basic five tests for annual physical examination. So when I say basic five, it's just the physical exam, and then what is the CBC or the complete blood count, the X-ray, the urinalysis, the fecalysis, just the basic five. But for this one, we're going to check the complete blood count, including these acronyms. So sometimes I just Google them so I can have a better picture of what are they. So there's the bond, FBS. I believe this is about sugar and everything. The uric acid will be checked as well. And the SGPT, this is for liver. Okay. And the creatinine, uric acid. Okay. So that is already included. Other providers, they will include it to your plan with an extra premium. But with Pacific Cross, this is already embedded. Okay. It means this is already included once you get the policy. Okay. So another feature that we have here is the value added benefits. When we say elective surgery, these are the scheduled surgery. For example, a client was diagnosed of myoma. All right. So there are cases of myoma wherein the doctor will ask you or will ask the patient if they want it to be removed right away, or let's say after a month or after 2 months, or it depends if they want it to be removed. Okay, that is elective surgery. So once you are decided to get that certain surgery, you just have to advise us at least 10 days before that preferred schedule. And we're going to arrange that within our accredited network. Okay, there you go. And then what else? We have the companion allowance. So for every hospitalization, and you have a companion, at least one companion, okay, we're going to give an allowance for a maximum of 10 days per policy year. Okay, so we also have a sports coverage. It covers recreational sports injury. Okay, and of course, this one, the free child coverage. So this is a great feature because if we have a pregnant applicant, let's say a pregnant woman decided to get a plan today, currently pregnant, okay, by the time that she delivered the baby, okay, after 15 days, the child will get the free coverage. So the coverage will follow the female insured or the mother's coverage, okay? So there. And we also have a personal accident benefit. This is already included, okay, no extra premium. So this is a coverage for accidental death. Okay, accidental death, not natural, not illness related, not disease related death, only for accidental death. Okay, so we will give a certain amount of money, depends on the plan or depends on the category. Okay, so by the way, the brochure that I'm checking right now, this is the updated brochure, and this will be effective tomorrow, April 1. Right. So I believe Aiko already mentioned that this is our last day to pay for the old rates or the for the old plans. Right. So the difference is that the old plan or the previous rate doesn't have these travel benefits. But if you're going to choose the updated one or the benefit that will be effective starting tomorrow, it will have this benefits, the travel plus benefits. Okay, so if you're going to check that, so it's like you have a travel insurance embedded in your medical insurance plans. Okay, there. And then for the optional benefits, if a client would like to get an outpatient benefit to be used for outpatient consultations or laboratory tests like that, and even for prescribed medicines, there you may get an outpatient benefit and also for dental benefits. Okay. So if you're going to ask me for the premiums, there's the premium table. So the premiums depends on the client's age. Okay, and sometimes if the client has a pre-existing condition, so if they are currently, if they have an illness that they want to be covered, we're going to evaluate that first, and the premium will be based on that evaluation. But for those clients with clean application, no declaration of certain illness, okay, we're going to follow the brochure price. All right. So, do you have questions?
Just
This
have a
brochure is up. Yep, you may download the brochures as well. Yes, I go ahead.
question. I think perhaps the participants also have this question.
Hmm.
Regarding the annual physical exam, it states there that uh, you have to schedule it in advance. So
Yep.
how can we do that, and how soon can they have an annual physical examination?
Yes, very good question, Aiko. Thank you for that. So once the account is paid, usually we suggest to wait for like a week. 1 week after the account is paid, you have to send an email to us. Okay, so we have to mention the preferred date and the preferred location. With that, we're going to coordinate it with that clinic or hospital or accredited providers or accredited APE, and then we're going to check if that schedule is available. Okay, so sometimes we can give approval in as early as 2 days, right? And once done, you will be required to. So we're once done. So for example, we confirm the schedule. Okay, we're going to send you a notice. It's like a form in a paper. You have to print it or just screenshot it using your phone. And then once you go to that clinic, you have to show it to them. So it's like an endorsement letter. Okay? Because right now, clinics does not allow walk-in applicants because, COVID protocols. So they prefer it to be scheduled ahead of time.
That's
Yes.
great. So meaning they as soon as 1 week, is my
Yes.
understanding correct? After their full approval payment and then approval of their policy, if ever they want to schedule by their own
Mm,
an annual physical exam, they can.
yes. But might as well, I'm
Okay.
going to suggest that the agent should be, ICO, should be CC or should be looked into that email. So if in case we need to do a follow-up, we can help you guys.
Yes. So other than my email, which they already have, when they do that request for annual physical exam,
Mhm.
what's the Pacific? Is there a Pacific Cross email they should email as
Yeah,
well?
so I'm going to type it here in our chat box. Okay. So the email would be client underscore services at pacificcross.com.ph. All right, and I'm going to share to you guys my personal email address as well, just in case you need help or you want us to do the follow up for you. So this is my personal email address. It's April underscore ethanol at pacificcross.com.ph. There you go.
Okay, that's great.
Yeah.
So, guys, please take down list these emails somewhere for easy access in the future.
Okay. So what are the other concerns that we're going to discuss? Aside from the brochures, the features, the benefits, the availment process, the use of website. Okay, what else do you have in mind, guys?
Can you share also, Miss Summer, as soon as
Mm,
they receive their cards from us,
mm,
does that mean they can already get confined or they can already use their policy or for consults, etc.? How
okay,
soon after can they use it?
very good question. So the standard turnaround time or the standard procedure for that is once the account is paid, we need to wait for 30 days. That is the waiting period. Okay. After 30 days, if in case the client needs it for confinement, you can do it or you can use it, provided that the reason for that confinement lies within these three categories. Okay. Please remember, it's either a valid or covered accident. Okay, or this is a viral condition like COVID 19. Yes, we still cover COVID 19. Or it's a bacterial condition. Okay. So you can use your plan after 30 days provided that this category or the reason for that confinement lies within these three categories: valid accident, viral condition, or bacterial condition. Other than that, let's say you have a pre existing condition of like hypertension, cancer, diabetes, okay, that will be subject to 12 months waiting period. Okay, that's the policy of Pacific Cross. But some of our clients who have that kind of pre-existing conditions that is being declared on their submitted application form, we're going to evaluate that based on the severity of the condition, okay, based on the current status. And then some of them were given a specific or a partial coverage during the first year. So if in case that those application forms ICO that was already submitted to us after evaluation, if in case that they will be given an option to cover pre-existing conditions, I highly suggest you guys to get that coverage. Why? Okay, so please take note of this. Nowadays, when a client is being diagnosed with COVID-19, and then go for confinement. Let's say they've been hospitalized for COVID 19. Usually, that COVID 19 will trigger the pre existing conditions. So, we have clients that have hypertension, diabetes. Okay. Some of them are already, let's say, senior citizens. Okay. So, once they get confined, having that kind of disease, COVID 19, the pre existing will show. So it's like they call it comorbidities. Okay. So symptoms like increase in blood pressure, something like that will happen. So I highly suggest that if you have an option to get a coverage for pre-existing conditions during the first year, might as well get it. So you will be prepared just in case, because we do not know what's going to happen in the next few days, right? So just in case that a client gets diagnosed with a COVID-19, so it's better to be prepared that their pre-existing conditions will have its own coverage as well. Okay?
Thank you, Miss Summer. That's very clear. Let's
Sure.
have a scenario. What if I'm
Mm,
one of the the Pacific Cross employees?
mm,
Say I'm blessed.
mm,
Um, and then suddenly one day I feel relatively uh, I don't feel well at all.
mm,
So I decide to
mm,
seek a consult
mm, mm,
with the nearest clinic or hospital.
mm, mm.
So is that already covered, or I mean, I should just go to the hospital, etc.,
Okay,
in order to get checked?
yes, very good question. So with that question, Aiko, I would like to introduce to you our newest feature. We call it the Kitika. Okay, let me just share it with you guys. The Kitika app. So nowadays, okay, if we are not feeling well, sometimes we have this kind of feeling that I don't want to go out of my comfort zone. I don't want to go out of my house just to seek consultation, because if I go out, I might think that my symptoms will worsen, right? Like we're going to acquire COVID-19 or whatsoever if we go to the hospital for consultation, right? So Pacific Cross come up with an idea of getting an app. It's called Kitika. Okay, let me just share to you guys what Kitika is. Okay. It's not here. I'm going to show it to you using Google. Kitika. Kitika. Telemedicine. So this is a telemedicine. It's a teleconsult actually. By the way, if you're going to access our Facebook page, Pacific Cross official Facebook page, you will see it there. That's the Kitika app. So wherever you are, as long as you have this Kitika app and you are an Android or iOS user, you have a phone, you can click this, you can access it, and then you can do an online consultation with a general practitioner or a doctor. Okay. So sometimes we discourage clients to visit hospitals or clinics as long as they can get access with Kitika. But if in case of, like for example, you have difficulty in breathing, or you really feel like you need an immediate attention or emergency care, okay, do not delay. You have to go to your nearest hospital, to the nearest emergency room. Okay. So with regards to your question, Aiko, as long as the policy has reached or has finished the 30 days waiting period, yes, you may now use the plan. Okay. If you have an outpatient benefit, you can use that outpatient benefit for consultation. Okay. So just in case that you have to be confined, your inpatient benefit will commence.
I see.
All right.
So
So
this,
guys,
mm-mm.
once you are ready, once your policy is in effect, you have to download this Kitika app. So it's available in iOS and Android Play Store or App Store.
So what do they use to log in Kitika?
Okay, very good question. So once you have your policy, you will receive an email for the credentials, for the login credentials for the Kitika app. Okay, so sometimes just in case you're unable to access your email or you can't find it in your email, you may send an email to us to ask for your credentials, and then we're going to help you. We're going to help you log in or register.
I
Okay?
see. Okay.
Yep.
So just a follow-up question. What if
Mm,
this client, her headache or her feeling of malaise is actually related to her exist or to a rise in blood sugar or
mm,
hypertension? So
mm.
is this covered during the first year?
Okay. So if the declared condition is covered on the first year, it will be covered as well.
Yes. Mm-mm.
Yep.
Okay. So guys, if you have questions, we have opened the floor already for
Mhm.
your questions. So now is the
Mhm.
time to actually ask us and Miss Summer if you have clarification about your plan.
Yes, guys. Go ahead. Okay, so you may browse the brochures if you have access now. Okay, so if you have questions, please let us know.
Okay.
Um,
Okay.
I have a question.
Oh, sure, go ahead.
In the benefit in the brochure, there's
Mhm.
this like ward, semi-private, and private
Okay.
columns.
Yep.
When is each column applicable, or like which column will be applicable to us?
Okay, so I believe the selected plan for you guys is within the private category. Am I right, Aiko?
Yes, that is correct. We have a
Yes.
very generous company and employer which got them
Yeah,
the private
the
copy.
private plan. So that means you have the highest coverage. So all coverage under that private column will be applicable to you there.
Okay, I see. Thank you.
All right, you're welcome. Okay. So you may want to check the brochures there to browse the benefits. And if you have questions, please let us know.
Perhaps we can do a quick round robin kind of setup just to
Okay.
make sure that everyone, I mean, no need to be shy. Everyone is
Yes,
able
of
to voice
course.
his or her question. So
Yeah.
Mark is good. He has already asked a question.
Okay.
Perhaps Sir Andrew, in case you have, just unmute, or
Yep.
if none, okay. And then how about Miss Bless?
Mm-mm. You may also
Okay.
type in your questions in our chat box, so
Sir
I'll
Gian?
just read it.
Hello. The question is about the APE. For the APE, we don't need any like medic doctor's orders, right? We can request for the full APE on our own.
Yes, you just have to request it to us or send us an email if you want to avail the APE, and kindly include the preferred date and the preferred location.
Okay, got it. So
All
that's my
right.
question.
Okay, so once
And
the yep, go ahead, sir.
so the APE is good once a year, right? Or
Yes, that's once a year.
okay.
Correct.
Thank
As long
you.
as the plan, you're welcome. As long as the plan is in annual mode of payment, you can get it as soon as your coverage starts.
Okay.
Yep.
Or 30 days after
Yes.
their receipt of their cards. And
Yes.
yes, FYI guys, because Nexif is very generous, they also avail the annual rate. So
Yeah.
yes, you can get an annual physical exam starting on the 31st day if you wish to do so.
Yes. Okay. So once you send an email for the request of your annual physical exam, we're going to communicate via email, and then we're going to send you the endorsement. Okay, if you have a printer at home, you can print it, or if not, you just have to screenshot or download it on your phone, and then once you go to the clinic for that schedule, you're going to show it to them.
Okay. Thank you, Sir Andrew, for your questions. How about Miss Bless? Do you have still questions unanswered in your mind?
Okay. I have one in mind. So from what I understand, this insurance covers ages 18 to 65.
Correct.
But then my two dependents are turning 66 soon. So does that mean that they will no longer be covered, or they will be enrolled to a different insurance policy?
Mm, very good question, Miss Bless. So after 65 years old, of course, we have clients 66 years old up to 100 years old. Okay. So I'm going to close this select brochure and let's open the Premier brochure. Hold a second. So if you're going to access our website, right? Let's access the website. Hold a second. There. So that's the website under Resources tab, Brochures and Forms. Okay. Let's check the product brochures. So we have here the Premier brochure. Do you see it? I'm now
Yes.
sharing it. Okay, good. Okay, so for Premier plans, we cover clients 66 up to 100 years old. So we can also
Okay.
cover overage employees or our parents, like that, even, yes. But for Premier plans, please take note that we only cover inpatient and emergency. So meaning
Okay.
this plan doesn't have an outpatient benefits. Okay.
Okay.
Yes.
So just to clarify,
Mm,
so say for example, um, they're already 66 years old, so they will be under that policy.
yep.
They
Correct.
will still be covered. Okay.
Yes. And that
Okay.
is one of the great advantage of Pacific Cross because other providers, once a client reaches 66 years old, they will
Yes. Yes.
terminate the policy. So it's not good because when we get to that age, that's the time that we really need to have a comprehensive insurance or medical insurance. So good thing that there is Pacific Cross that can cover them.
That's good. Thank you for answering my question.
Thank you.
Uh, Thank you, Miss Bless. So I just have a follow-up to her question. What if
Mm,
the senior insured is 65, but in 3 months will be turning 66?
okay.
So which policy applies to this person?
Very good question. So with Pacific Cross, we recognize the current age. So for example, today we're going to pay the policy and today you're 65 years old. Okay, we're going to use the select brochure or the select price because you're 65 by the time that you're going to pay. Okay, but after, let's say after a week, you're going to have your birthday. Okay, so you're going to turn 66. So that's the plan that we're going to follow.
Ah, that's nice.
Yep.
Okay. Thank you, Miss Bless and Miss Summer. How
Yep.
about Sir Gian? Do you have any questions?
Okay, you already answered my questions earlier. Thank you.
Okay,
Okay.
thanks, Sir Gian. That's good. It's all clear. Who else?
Nice.
How about
Yeah, this is Andrew.
Yep.
Yep. Hello.
Yes,
yes,
Andrew.
yes, go ahead.
Yes. My question is on the regarding principal. So
Mm,
since I think my wife is also considered as principal
yep.
along with the dependents
Yep.
for our two kids.
Mm-mm.
Are they all covered similar to what I can receive in this coverage?
Yes. If you have the same plan, like for example, you have Select Plus Private, all of you have that same plan, you will have the same coverage.
Okay, great. Yeah.
But the
Confirming that
advantage
they
of
all
your
have the
wife,
same coverage.
yes, yes, but the advantage of your wife is she is a female insured, so just in case that she gets pregnant, so if she's having that select plan, she is entitled to get the free child coverage for the baby. That's the advantage of being a girl.
Okay,
Yeah.
great. Thanks.
Okay, you're welcome.
Okay. So thank you, Miss Sommer. It's been very enlightening,
Thank
certainly,
you.
and very helpful this
Yep,
session.
yep.
So for I'm just gonna make a last call for questions in case
Mhm.
you have. But of course, if you think of questions later on after this meeting, you can always contact me or Miss Summer as we have both of our contacts already.
Yes, anytime, even at night, even at the wee hours of night, we're still awake. Yes, because Pacific Cross is always
Oh,
hashtag here for you. Yes.
yes.
Mm,
By the way, this wasn't asked, no, but we mentioned about emailing as the best way to reach us because of the busy
yes.
hotline. Pero in case they still want to talk to the
Mm.
hotline, what's the number that they
Okay,
can
that's a very
contact?
good question. I'm going to send it here in our chat box. So the numbers to call is 8230-8511. So that's our client services hotline. Okay. 230-8511. So just in case that the concern is urgent, like for example, it's an emergency, it's an emergency case and the number is not reachable. So no one's picking up the phone or the line is busy, you can coordinate with ICO. ICO can coordinate with us. So we can help. And it happens all the time. We're doing that here.
Yes. Thank
You're
you, Miss
welcome.
Summer. Okay. Sige. So, if wala na kayong questions, can we take a group photo as